A very good afternoon, ladies and gentlemen. My name is Barbara, and you are tuning into the Melaka Manipal Medical College webinar series. We are starting a new series today that will span for the next 8 weeks, interchanging between topics related to MBBS and topics related to BDS. This week, the Doctor's Road to Specialization, we will explore the topic surgery versus internal medicine. Joining us today are two of our esteemed professors, Professor Dr. M. Nachiappan, Head of the Department of Surgery, as well as our Clinical Director, and Professor Dr. Mura, Head of Internal Medicine Department. Good afternoon, Profs.
Yes, good afternoon, Barbara.
Prof. Nachi, Prof. Mura, good afternoon.
Good afternoon.
Good afternoon, Barbara.
Can you hear us?
Yes.
Do you hear me, Barbara? Do you hear me? No. Can you come here? I do not.
I hear you loud and clear, Prof. Mura.
Do you hear me?
Yes, I hear you loud and clear. Thank you for joining us. I see you on campus today.
Yeah.
Yes. Excellent. Prof. Nachi, good afternoon.
Good afternoon, Barbara.
Thank you for joining us, and thank you for spending your Saturday afternoon with us, as well as our viewers today. Now, before we go into the meat of today's topic, ladies and gentlemen, I'd like to introduce our two speakers to you and present their credentials. Yeah, Prof. Nachiappan, who was our guest in the previous webinar, graduated from Karnataka University, India, did his fellowship with the Royal College of Edinburgh, UK, and he's had experiences in Singapore and in the UK. Currently, he's our head of department for surgery, as well as our director of clinical studies and student affairs. We have Prof. Mura, who graduated from the Institute of Medicine to Myanmar and did her fellowship in Australia under the Australia College of Medicine. She too has worked in the UK, and we're delighted to have them share their experience with us in their respective fields. Okay, so today what we're going to do is we've got questions that we've got lined up, profs, and I'm going to address the question to each of you specifically, and the objective is for you to share your experiences so that our viewers today who are either deciding on becoming a doctor or who are in the process of studying their MBBS could be inspired by you, right? So if you could, Prof. Mura, we'll start with you and, Prof. Nachi, if we could start with you. Could you give us an idea on the brief area of your specialization, which is surgery and subspecializing in neurosurgery? Prof. Nachi?
Okay, this neurosurgery, you all could have heard that. What we do is that we are actually surgeons, and we confine our surgical skills in operating with lesions or issues related to the brain, to the spinal cord, or the peripheral nerves, okay, as well as the accompanying along the nerves. There are all the brain areas which are supplied by blood vessels, and that means that we are talking about arteries and veins and so on, all along that, as well as the skull base, as well as the spine, the bony part of your spinal column. Also, we deal with that, and of course, neurosurgery, you treat from neonates, pediatric patients up to old age. Okay, and there is a wide spectrum of and scope in the practice of neurosurgery.
Okay, thanks, Prof. Nachi.
Yeah.
And Prof. Mura, you specialize in internal medicine. Could you give us an idea what exactly is internal medicine? I mean, what's the coverage of that?
In fact, internal medicine is continuation of the medicine after we graduate with MEBS or MD degree. Is further mainly in the practice medicine, which does not need surgery. On the other hand, what I want to say is, in fact, physicians are non-operating doctors. In
Okay.
fact, the principle of the study, the principle we practice are the same, but in some disease, most of the diseases with internal medicine, we try to get the
Could we ask our
diagnosis,
viewers to mute
we
yourself,
do.
please? Could we have all viewers mute themselves? Thank you. Prof. Mura, sorry for the interruption. Could you continue?
Okay, so we physicians normally we we get the diagnosis, we request the investigations, and we confirm the diagnosis, and most of the time we get the medicine. Not only medicine, we expect the patients to heal by their own immunity or own defense system as well. But during that time, if we need surgery, we will refer to the surgeon that we do not know. We are not trained to cut the things, so we need surgery. The same, most of the cases are also under the surgery ward, but then may or may not need the surgery, so they are sent back to us, so we continue with our practice. So that is I don't want to say medicine is the different and surgery is different. It's the same, but we are not operating doctors.
Okay, all right. Now, how did you decide on your specialty, Prof. Nachi?
Yeah.
Okay, in my first year, when you are exposed to anatomy, what struck me was the beautiful architecture of the brain. When you're in the cadaveric dissection, we found that it's a very concise area which is within the cranium, and this brain is uh, do not have features which are so evident, like hands and legs, and which you can see. This looks like a fairly homogeneous kind of thing, but there's a beautiful architecture within that, and that architecture is the compact architecture is the one which controls your every sense of our body, whether it's a vision, whether it's a hearing, whether it's a taste, whether it's a motor movements, whether your breathing, your heartbeat, and your emotions, and your personalities. Everything is sort of within this. There's such a perfect coordination and control, and that was what was fascinating. And I said, no, I need to know more about it. If I'm going to specialize at all at that time, in the first year of medical student, I said it is very likely to be brain. I wanted to be involved with this kind of superstructure, which is our within us. Yeah, that's what decided. In fact, I decided very early. Yeah.
Okay. And Prof. Mura, what about you? How you did your degree in Myanmar, Prof. Mura, which is
Yes.
It's extremely difficult. I mean, if we
Yes.
look at choosing study area or study, I think in Malaysia we are quite blessed. Our young people are quite blessed in the sense that they have a wide variety of choice.
Yes.
But I believe in Myanmar the situation is different. You've really got to be the top notch.
Yes.
But at the same time, studying medicine puts so much pressure.
Yes.
So,
Yes.
having gone through that pressure cooker of doing your MBBS, to be inspired to further specialize in internal medicine, how did that come about?
Yeah, thank you for your questions. In fact, my life is much, much different from my life, and our life in Myanmar is different from people around the world. What shall I say? We cannot choose anything on our own. Everything is what countries need. So what shall I say? In fact, when I got through my MEBS, I got distinction in both medicine and surgery. I wanted to become a surgeon, and I applied and then I got a very good foundation of principles of surgery when I was like now 10 months we are for political reasons, the universities are shut down, and now no such online teachings. We have to go back to our own state and then find out where to get the knowledge. So my dad brought me to the respective hospital and request the surgeon to teach his daughter about all these principles of surgery. So I really got a lot of time to study surgery, but in the end of the day, when I applied for us as Director General of Medical Education was the one choose for us. He said, "You are a lady. You are not suitable for a general surgery because in those days there is no such, and they need a lot of long hours. You ladies cannot stand all this, and you also got the distinction in medicine. You choose medicine. That is the reason that I have to choose medicine, internal medicine." And internal medicine, again, in our time, in those days, only a few, there are a lot of doctors nowadays, so cannot go to subspecialty. Especially I was only those got the highest grading 5 out of 5 or 4.5 out of 5 are selected for the teaching post. I was selected for the teaching post. We are supposed to start with the basic science, anatomy, physiology, tutors or demonstrators. So I was taken as a physiology of demonstrator in physiology, and these are nurtured to become a physician. Those are selected for anatomy, tutors are nurtured to become surgeon. That is our system. So that after then I have to go for the postgraduate entry. At that time, only 4 or 5 seats all over the country in a year are selected. So need to be on everything in my life to stood first. I have to be on the top. Otherwise, I will be left out. So then I become as but in the end of the day, through my life and I'm talking about my system. I'm really thankful to that DG who decided for me to become a physician, because in the end of the day, in our is quite different. And to do a surgery, we need to deal with the anesthetist, a lot of cooperation, coordination, collaboration necessary. For the physician, we do not need much. We can decide on our own. We can run our own clinics, and so that even I become old, we can even more matured and more knowledgeable. And it's the more older, the more we are better than. And then when you become old surgeon and then cannot do the operation very well, the eyes are getting unable to see, So that is why I'm thankful to that DG, and I'm also proud of myself to be in internal medicine. And then subspecialty, on the other hand, our time there's no such. Especially, I'm chosen in the internal clinic tutor in the medical education. I cannot choose the country. Our medical education director idea is those who are teaching must be internal medicine. We are not supposed to go to subspecialty, either cardiac or CV, so the cardiac physician or renal physician, or no. We are supposed to be in the internal medicine, and internal, because they are able to teach all the subject for the undergraduate. But for subspecialty, we include them in the postgraduate training, just to include just for a while. In the end of the day, the university is mainly under internal medicine. That are the reason that why I want to be there, and I am proud of to be there.
Okay. But yeah, the situation has changed today, and kids today
I'm
are
talking about
thrown.
my experience. Yes.
A lot
It
of
may not
choices.
be applicable to anybody. If
Right.
you ask me my life, why I choose that, I happen to be like that. Yes.
Right. So, Prof,
Yes.
Nachi, let's start with the road. I mean, the kind of years. I always tell students when they are coming to inquire with us at Melaka Manipal, I said, you got to be ready. It's a marathon. It's not a sprint. Firstly, the MBBS is 5 years. It's 2 years longer than any other degree, like business, accounting, law, that sort of thing.
Yeah.
And then subsequent to that, you've got to fulfill your work experience, which is in Malaysia, 2 years housemanship compulsory. And then you got to gain further experience as a medical officer before you can embark. Was that the same for you back then? And how has it changed now?
Okay. Professor Mira, I told about the ordeal. It was not easy. neither was it easy, even though I have decided very much earlier that what I want to become. But at that time, the situations and the requirements in the country of Malaysia, okay, was different. And what has happened was when I finished my undergraduate studies, I did my housemanship in Malaysia, followed by they sent me to, I did my housemanship in Moa, and I did my MO-ship. They sent to Ipoh Hospital. After a year, they sent to me a rural clinic. Okay, this is sort of a rotation which they always do, because rural areas they sent for 2 years, which means that there is no way that you could embark on any specialization, because in the rural area you are the only doctor, you are doing the routine common illnesses and so on. And after 2 years plus, I wanted to do surgery, because at that time you have to do a general surgery. There was no direct path to do a neurosurgery. Right. And yeah, and since I can't do anything, I was advised by some friends. I said, you better apply to join the armed forces. Once you go to the armed forces, then they will give you a training post thereafter. So I applied, and I was in the armed forces of Malaysia for 3 years. Then thereafter, I got into University of Malaya. Then at the University of Malaya, when I was doing that, and I went to Edinburgh, I did my part 1 in FRCS in general surgery, and in the 4th year I did the part 2, which is the final of the FRCS, and then I was a general surgeon. And as a general surgeon, I always volunteered myself to do any surgeries to assist the neurosurgeons who were there on a neurosurgery. And thereafter, I went to Singapore, and I was a senior registrar in neurosurgery department in Singapore. Then from there, I got invite actually, like scholarship to Oxford, and I did my brain as well as spine fellowship in Oxford. And then I came back to Malaysia, and I was lucky in the sense that there was a lot of technological advances were taking place when I was in Singapore. There was a lot of minimally invasive surgery, endoscopic surgery, stereotactic surgery, and so on. And that was the era in 1996, 97, 98, and so on. And it was sort of due to advance in optic technology, fiber optic technology, and so on. And I quickly introduced this, and we started doing first. I was the first in Malaysia at the time to do a functional and a robotic neurosurgery in University of Malaya. And thereafter, I did it with the instruments which are borrowed from the surgical companies, the instrument companies. And what has happened was the university hospital was reluctant to buy it. Okay, they said it's a lot of money and so on. But what happened was there was a hospital in Melaka, okay, Pantai Hospital. They were willing to spend several million on that, and that is how I came to Melaka. And all the stereotactic surgeries were regular surgeries were done first time in a private hospital here in Malaysia. It was at Ayakuro, Melaka. And for radio surgery, we also had a radio surgery. At that time, we set up in the first radio surgery unit was set up not at Pantai, but it was set up in Makota, also in Melaka. And that was why I came to Melaka, okay, because the radio surgery was available. And at that time, there were only a few surgeons, okay, who were able to do radio surgery. And there was one surgeon from Singapore who became a health minister in Singapore. He and myself were the only one in this region to do. So we were doing it in radio surgery in Makota, and the other surgeries were being done in Pantai. So at that time, there was no program here, no local program and things like that. Things have changed a lot now. We have got mentors who will guide you. And if you are interested, there's a fast tracking and so on. You don't have to spend so many years. Like I spent a lot of time, 5 years for MBBS, 4 years in FRCS general surgery, and 5 years in neurosurgery. So nowadays you don't have to do that. Okay, after MBBS, you got your housemanship finished. Then your MO-ship, you can always request for a course that you are interested in, and you have shown some interest as well by appearing for part 1 examination of in the surgery. And nowadays we don't call it FRCS. The beginning we call it MRCS, and we have that. Then you can go to a master's program here in neurosurgery. Okay, master's program neurosurgery only 4 years. Okay, at the end of 4 years, that means after MBBS, as you're doing house MO ship, within 4 years you can become a surgeon, neurosurgeon, or a plastic surgeon. So we have got programs in plastic surgery, pediatric surgery, neurosurgery, and cardiovascular surgery you can do, and the urological surgery. We have master's program locally, so we can do it within 4 years. But of course, the downside, as Prof. Murai said, was when you're coming to teaching, we have gone through this sub-specialization straight away, and you will not be able to teach the other part of surgery. Like my case, it was not a problem because I was a general surgeon first, then I became a neurosurgeon. So it was not a big deal at that time. At this time, yeah. This is my sort of my path, yeah.
Right. And Prof. Mura, as you
Yes.
mentioned earlier, you had to graduate top of your class, and then you got to
Yes.
do your master's program. I am interested in terms of how did you go about securing the fellowship with Australia?
Oh, this is okay. In fact, after our is up to 1972. No, yeah, up to 1970, we sent the scholars to England to get that membership, MRCP, FRCS. But after 1972, we were able to launch master programs, so that since then, and then recognize the same with the membership. But on the other hand, master program we need to attend in those days 2 years together with the dissertation or thesis. But membership is, what shall I say, being a broad degree, it's just need to, by 3 months or 4 months time, when the exam coming, just go and take the exam. These are the things that director generals, they wanted to change to master program. On the other hand, so they save the money on the other hand.
Right.
So that, so good, but it's different. Okay, so that for us is once we get postgraduate degree, we have to serve the country till age of 60. But ministers are changing all the time. One minister come with their different opinion, another minister come with a different opinion. And when ministers have their own children who are taking this, having these of MBBS courses, they want to send their children abroad. They change the policy again. At that time, I'm already age of 42 when it was the scholarship competition all over the country. 12 are only selected, so to send for that membership in England. This is, I have to compete with my very young, my students even. So I was chosen I was one of the 12. So I was sent to England. That's why I was able, in those days, in my ancestors' time, we are never allowed to work in foreign countries. So proud. Burma was once a very rich country. So proud, never allowed their own people to serve other country. That is, but my time, and then the scholarship money was sent by the Burmese embassy. But my time, we are not enough with that amount of money, so we are allowed to work. But for various reasons, I was called back from my country before I finish my exam, so that I have to go back because they need. Then that time, the qualifications and these are, I don't need to take exam, so I got that tropical medicine fellowship that but I didn't apply. I applied only only 2001 or 2000. Yeah. So
Okay.
that is, yeah, that is what our degrees. And then in those days, our degrees are recognized by our, what shall I say, General Medical Council. We didn't need to take PLAB exam. We are able to work there. Yes.
Right, right.
Yeah.
Now, both of you have worked in the UK, and one of the things that inspire young people today to do something like medicine is the concept of global mobility. You are able to, work in hospitals around the world. What is it actually like? I mean, both of you have worked in a variety of countries, but let's talk about the big ones that all young people aspire to: US, Australia, UK, Canada. Country where you get snow and four seasons. What was it actually like, Prof. Murat, to be working in a UK hospital? And now, you lead our students in Melaka Hospital. Is there a big difference, or the only difference is the weather?
Okay. The thing is, if you ask experience in England, taking exams in England, working in England, and also I also did most of the attachment in Singapore as well. It's very much useful for the training our students now. It's really, really useful. And it's also for me very useful to work in Malaysia, these hospitals. Yes. If I do not go there, only in my own country, I won't be able to do what I'm doing, what I'm serving for my students. So I'm very helpful to thank to my country as well to send me to a scholarship student there. Even though I was called back before I finished, I am really thankful to my country to serve the students what I'm doing and to serve the country on the hospitals here. Because of those experience, I'm able to do. Yes.
Right.
That exam, and the thing is, I don't want to say it's much, but Malaysia students have, I would say, no difficulty, because to me it's a bit very, very different. And we do not use English to be, we are taught English only at age of 12, just read and write. We have some anti-English sentiment we do not use. But when I go there, a lot of difficulty to exam purpose is all right, but the social English to work is, I have a lot of difficulty. But for that sort of part, Malaysia student won't have any difficulty. And the weather-wise, yeah, depend on for us. Because of come from different country, I make myself, my life must not be affected by weather. My life must not be affected by the food. So I try to survive. Yeah.
Okay.
So it's
What
nothing
about you?
different.
What about you, Prof. Nachi? Is there a difference, working in different hospitals around the world, or it's just the same?
No, I had a very interesting career actually. When I was in North in Scotland, that is in Edinburgh, and we used to have snows, So
Right.
during winter months, we had a lot of difficulties. Okay, and especially when you're on call, you must have you would have I would have warmed up my bed, for example, and just settling in nicely under the blankets, and half an hour or 45 minutes later, there will be a call from the hospital. They said you have to go. Then you come out, you'll find that there's a half a foot of snow, and of course your cars all you got special tires and so on with chains and so on. Anyway, we have to plow through the snow, and then you go and then deal with the problem. 2 hours later at 3 a.m., come back to the house again, warm the bed and lie down, and another half an hour they call you again. So sometimes the winter, but the summer is so good. Okay, we enjoy the weather is very mild and very comfortable, and we all enjoy the weathers in summer. And when I was in Oxford, I had an opportunity to go 4 months to Greece to work. Okay, that they have internal arrangement between Oxford, Greece, and Sweden. So I did 4.5 months in Athens, and also 4.5 months in Kaloniska in Sweden.
Oh,
Okay,
lovely.
Yeah, so I went around holidays for all the Scandinavian countries, you know, very easily. So I had a very good time. I really enjoyed my time. And what is happening? The people, my consultants and so on, they did not withhold any praise. If they like what you're doing, they really praise you. And if they don't like what you're doing, you have done a mistake. They're very politely they will sort of take you to task, you know, and
Right.
you never knew that they were scolding you actually.
Okay.
Yeah, they make you very comfortable, and
Mhm.
the patients were not actually at all demanding like here, no. I will
Mm.
sue you kind of thing. In fact, very surprisingly in UK, they think that if any mistake or anything has happened, they assume that the doctor did the best, but it so happened the nature of the illness is such that it didn't work out. You know,
Mm.
they could be also very forgiving. Yeah.
Okay.
Yeah.
Now, I'm going to put this question to the both of you, and when we talk to students, and I would say to a certain extent, I'm going to blame it on media, TV, and the shows that we watch, where any medical related thing. The surgeon is always in all its glory, standing there all gloved up and going 10 blade. Um, Prof. Nachi, is it really as glamorous as we see?
Yes, I agree with you. In a general public, they feel that somebody is holding a knife is um, maybe macho thing, you know, and they look that. But I don't. I see. But even neurosurgery, we depend on quite a lot on neurophysicians. So we call them neurologists, and
Hmm.
they diagnose. Say, for example, I am doing a surgery for epilepsy. Actually, we depend a lot on the neurologists to be able to diagnose the epilepsy, number one. Number two, the type of epilepsy, the area from where the epilepsy is coming, and so on. We do help sometimes to make a hole in the head and put some electrodes in the brain to really work out where the focus exactly from the you are getting the epileptic seizures from, for example, and then they go back with these probes to the ward, and we do a 24 hours kind of monitoring, yeah, for epileptic seizures and so on. And they tell us, okay, these are the areas and so on. And from there, then we go and do a surgery. So actually, there's a lot of cooperation between and coordination, collaboration between physicians and surgeons, and a lot of things that there is blurring actually of the jobs. For example, at one time, I remember that for coronary artery disease, where blocks in the heart vessels were done, not mistaken by what do you call neurosurgeons, but now it's almost exclusively done by cardiologists who are physicians. Okay, they
Hmm.
put the stent, they put the stents and so on. At one time, we do endoscope to look into your stomach and duodenum, upper endoscope, and so on. All were done only by surgeons. But now, almost all of them are now done by physicians.
Right.
They do that, and they tell the surgeons what is the problem, and whether you need a surgery or not. Suppose you got to say a stomach, then we go and operate. And there's a lot of internal consultations and collaborations are going on. And I think all of us have got our own strengths, okay, whatever you want to do. But having said that, if you want to choose any surgical discipline, not necessarily neurosurgery, any surgical discipline, you should be uh, a little bit of hyper. Okay, you don't like sitting in one place and dealing with the patient, but you want to move about, you want to walk about, you want to stand, you want to, that's kind of a hectic kind of lifestyle. It suits you, depending
Hmm.
upon your personality. Maybe a surgical discipline is very good. If you like art, crafts, cutting with a knife or scissors or whatever, it's very good. And if you are technologically savvy, yeah, you're playing all these computer games and so on, hand-eye coordination, because nowadays a lot of surgeries are done not on directly, but through the video cams, and we are operating not directly on the patient. We are controlling uh, the cutting or tying up vessels or whatever it is in the abdomen or anywhere. We are doing it outside of the patient's body by controlling instruments and equipments and so on. And so this hand-eye coordination, where you're looking at the monitor on the wall, but you're operating actually on the patient. Okay, so there is no direct field, but the indirect field. So so if you are technologically savvy, if you are a little bit of hyper, and you like arts and precision and so on, I think neurosurgery is or any surgery is fine. And neurosurgery is, of course, you're willing to spend a lot of hours. Some surgeries may take 8 to 12 hours. On my own, I think I never did any surgery more than 12 hours long. But when I was at university in Malaya, I assisted. In fact, I offered to assist my neurosurgeon who did one aneurysm surgery for almost 30 hours. Okay.
30 hours.
Yes, yes, and we had a lot of problem. I never assisted him again.
Okay. Now,
Yeah.
Prof. Mura,
Yes.
you mentioned that internal medicine has a bit more flexibility in terms of the hours, the scheduling, and things like that, especially if they're running their own GP practice.
Yes.
But in today's competitive world, where that every commercial area would have 2 to 3 clinics, do you think it's becoming an internal medicine specialist has its own set of challenges now?
Do you mean the clinic? I talk
Yeah,
about the
in terms of clinics. So it's a lot of people say internal medicine. You have control over your time. You're not going to
yes.
be caught in an OT for many hours. But are there any hidden challenges? For example, is it a situation where a lot of people are deciding to do internal medicine? So there's a lot of internal medicine specialists, and patients then can pick and choose who they want to go to. Or do you feel that there is still there's still room for students to consider doing internal medicine?
But the government and the clinic is different. In
Right.
the government job, the salary is the same, whether surgeon, internal medicine, or psychiatrist,
Everybody
pediatrician,
makes the same money.
all are the same. However, in the clinic, internal medicine, it means internist. Internist means general medicine. So from there, nowadays they divide into cardiac, chest, renal, hematologist, different sub-varieties nowadays. So after finishing that postgraduate MRCP, 2 years later, they have to go to the subspecialties nowadays. So nowadays, quite difficult to find internist. Because our time, like Prof. Nachi said, he was a general surgeon for many years. Our time, I have to be our time, my seniors have to be general medicine internist or general physician for many years. After that, if the country need, they train them and to become their subspecialties in different areas. So, but when you look into in the outside clinic, in the clinics and in the commerce, people, they think that only those specialized in the cardiac, they are able to see the cardiac cases. In fact, general medicine also able to see, but people mindset is they think they are the ones, so they go there. So internal medicine specialists, if they stay there without going to subspecialty, except outside the hospital, the patient they receive, I mean, I'm talking about my country, the patient they receive is less than those who are dealing the subspecialties. But on the other hand, before becoming subspecialty, they have to go to internal medicine first, at
Right.
least 2 years. And then after, but in our country, we are not allowed to go to subspecialty because we are from the education. We are kept there without, so that only these people are able to teach all the specialties. So that is our country system. Yes,
Okay.
but our country system, if we go like that, and we are not allowed to do any private tuition, so and so, so that in the clinics, if we do not go to subspecialty, earning is less than those who go for this subspecialty. Yes.
Okay. All right. Now, Prof. Nachi, you touched on how both is very correlated, and I think Prof. Mura, you would agree, because at the end of the day, in any MBBS degree, the two largest segment is medicine and surgery. And like Prof. Mura said at the very start, the one diagnosing is the internal medicine specialist. And if there's any surgery required, that's where the surgeon comes in, correct?
Yes.
Right. Okay. So, ladies and gentlemen, if you're on your degree and you're thinking to cut or not to cut, it really depends on your own preference, as both professors would have pointed out to you the scenarios, the journey, the satisfaction. I draw and conclude that it's almost the same. But as Prof. Nachi and Prof. Mura said, surgery is more demanding on your time. So, we encourage you to explore as you go through your MBBS journey. But at the same time, give your full attention to both medicine and surgery as subject matters, because you cannot be one without the other. Okay. So in closing, any words of wisdom, Prof. Nachi, we'll start with you. Any words of wisdom for our future doctors tuning in?
Okay, I think if you are into training now, please have an open mind. You might change your area of specialization later on, depending upon the your sustained interest and also the challenges. Whether because you have to balance your personal life and your what do you call your working life, and as well as whether your passion will be sustained or not to do a certain other surgery or medicine. What I want to tell you now is that the path is nowadays much straightforward and so on. And in my time, you have to be a general surgeon, then you have to do neurosurgery. But now what has happened is that they're having a master's program, it's a 4-year program, and where they condense the general surgery to 1 year, and the next 3 years you do the sub-specialization. Okay, now what is happening is in the last few years, in the 4 or 5 years, you got a sub-specialization. So at one time, neurosurgery was a sub-specialty from surgery. Now you got sub-specialization in neurosurgery itself. You got a pediatric neurosurgery, you got vascular neurosurgery, you got a traumatic neurosurgery, you got base of skull neurosurgery. These are endless actually. Functional neurosurgery, neuro-oncologists who only operate on tumors and so on. They got spinal surgery, okay, and so on and so forth. So you got subspecialties as well. So what has happened is that in every surgical field, even in general surgery, where they have got upper gastrointestinal surgeons, we got a colorectal surgeons only on the intestine. They have got a hepatobiliary surgeons, so we operate on liver, gallbladder, and pancreas, and so on. You got of course lung surgeons, cardiothoracic surgeons, pelvic surgeons, and so on. So the sub-specialization path and the sub-specialization paths to in surgical fields is enormous, and we are dire need of many of the surgical disciplines. We have only one specialty, one specialist is available for that field, for example, and there's plenty of scope. Although that we've got at the entry level a lot of doctors waiting to be posted and so on, but they will be eventually posted because our government is committed to providing job for only for medicine doctors, that they are guaranteed a job, even though they may have to wait 5-6 months or more. But Beyond that, for specialities, there are plenty of scope because there is the vacuum, big vacuum, okay, in the different specialities. That's one. So you please continue to have your passion burning, okay, and you always don't forget the that you must be altruistic. At no time should you forget that you are here to help the needy, the poor, and so on. You should be able to feel their suffering and pain, and you should be always willing to help, give a helping hand. If not, when they call you at 2 a.m., you will be you won't get up. Right? You'll be cursing. No, you should be able to happily go and say, I'm able to help that person, even though it's a 2 a.m. or 3 a.m. Who else? Okay, they look up to you. And then other one is a must be a good communicator. Okay, you should be able to communicate well with the patient. A lot of times you can heal illnesses just giving an encouraging words, explaining what was their condition, what can happen, and so on. And if you are a surgeon, you should be also able to communicate with your anesthetist, with all the supporting team, with the nursing staff who is assisting you, okay, for radiologists, okay, pathologists, and to whom you send a specimen and so on. Not you should not be a fighting type. You should be accommodative, and you should be able to work and communicate with all of them. And you should, when you're getting married, you always get an understanding spouse that you are a surgeon, and your job is demanding and so on, and they should be willing to sacrifice that understand that you will be away sometimes, some nights and so on, and that's it. But whatever it is, when you can, as a surgeon, and more so as a neurosurgeon, when you can stop, you can bring down the episode, the epileptic seizures. You can control that. Your movement disorders can control that, can improve their functions. Okay, so whenever, after so many hours of surgery, when you bring that kind of comfort, I think that's the most satisfying and fulfilling part of it. And welcome to whatever field that you want to specialize. Yeah.
Thank you, Prof. Nachi.
Yeah.
Prof. Mara, what about you? Any words of wisdom for our future doctors tuning in?
Yeah, doctor work need a lot of passion. If you have passion, you are successful everywhere. Important is to have sympathy, empathy, if not only your brain, but also your hypothalamus level, not only cortical level, but hypothalamus level is also very important to become a successful doctor. Whether surgeon or what physician, we are doing the same. We are saving the people's life in different ways.
Okay.
Sometimes, yeah. For example, when I was, for example, I remember is alcoholic, is chronic alcoholic, and was found unconscious and very breathless, came to the hospital. I didn't expect him to be able to survive next day, just by knowing that he because he's alcoholic, is breathless, is having heart failure. I gave just one injection of thiamine, one ampule, and next day he was able to sit up. But that may not be appreciated by the people, but people appreciate, like Prof. Nachi said, if they carry the knife, they are very appreciative,
Yeah.
Our work is never seen by any people, but we go by just simple injection and just, this must be this, use scratch our head, cortex, it's safe. But that work is not appreciated by most of the people. But we know what we are doing. So in the end of the day, our aim is to save the people's life. That's it.
Yeah.
Yes.
And I just like to add, Prof. Mara, and no offense to Prof. Nachi and the surgeons out there. I think a internist is, if you feel that you're not well, a good internist would be the one that would take you through the right journey to getting well, because the internist is the one who would start your diagnostic journey. And
Yes.
if they point you down the wrong path, then, you know, there's a lot of endless pain that you might have to go through. But, you know, if they point you down the right path and connect you to the necessary colleagues within the healthcare community, whether they are surgeons or you know, subspecialist physicians, then your road to recovery and hopefully healing would be a lot shorter. So
Yes.
I think students who are able to see things on a wider picture, being a internal medicine surgeon or physician would be a great path for you to go down. You know, you would more or less play a back role, right? Because more often than not, if a patient is pointed to have a surgery done, after the surgery, it's the surgeon's hand that the family shakes. I've been a caregiver myself. I know that as well. It's not often that they would come back to the physician's office and says, thank you so much for pointing us to that surgeon and solving that issue. So that there's a lot of other characteristics or personality, you know, that you need to take into consideration. But honestly, if you like to solve puzzles, right, and be able to see the whole journey, then an internal medicine specialization would fit you well. Right, Prof. Mura?
Yes,
Okay,
of
excellent.
course.
Thank you
Thank
so
you.
much, Prof. Nachi, Prof. Mura, for joining us. Our panelists are going to be online with us for the next 10 minutes or so as I talk you through some other things. If you have a specific question for our listeners out there, please feel free to put it in the chat box. If we are not able to take your question, we will get back to you by WhatsApp and email after this event. Just a reminder, you are tuning in to the Melaka Manipal Medical College webinar, where we will be focusing on the areas of specializations for the next 2 months. At Melaka Manipal, we offer a foundation in science, a bachelor's of medicine and bachelor's of surgery, also known as MBBS, and a bachelor's of dental surgery. Our program for both MBBS and BDS are 5 years. October intake is now ongoing, and we pride ourselves on the fact that we give you an opportunity to be future ready. You know, both our professors who are heads of their department comes with a wealth of experience. They've not just worked in Malaysia or in their home country, in the case of Prof. Mura in Myanmar, but around the world. And what they're bringing to the table is the experiences and shaping the curriculum so that you are future ready. Let's face it, medicine is no longer an ironclad rice bowl. You know, it is like a job that you would have seen your parents do if they are not in the healthcare industry. So you do need solid skills and mentoring from people who have got solid experience, like our good professors here with us today, in order for you to spear your journey to become a successful specialist in the field of your choosing. Melaka Manipal is located in the city of Melaka. If you are not from Melaka, you've been missing out. And take it from me, I'm from KL, lived in KL for the last 45 years, had no idea we had such a gem of a city in the country of Malaysia. What really makes Melaka stand out is how the community, which are your patients during your clinical years when you're treating them, they welcome you as one of their own. And that, young doctors to be, is something that money cannot buy, okay? So bear that in mind if you are looking for a place to do your MBBS. If you are already studying with us, you know, buckle up. Your rides just got more exciting. We've got a host of facilities and activities. You know, as Prof. Nachi said earlier, you do need to have activities to balance and de-stress. We recognize and appreciate that. So we give you ample opportunities to participate in sports, cultural events, charity events during your study journey with us. Okay, so we do not seem to have any questions, right? So Prof. Mura, Prof. Nachi, thank you so much for your time today. And to our listeners, thank you so much for tuning in. Again, if you are shopping around for a medical college to do your MBBS. We hope you remember us. Feel free to drop us a message either on Facebook. All our contact details are available on our Facebook page. You know, you can't go wrong because you would be joining one of Malaysia's oldest and most established private medical and dental colleges, where we've got ample patient beds for MBBS and patients for BDS training. We are located in Melaka, just 90 minutes from the capital of Kuala Lumpur, where the people welcome you as one of your own, and you will be mentored by great physicians and surgeons like Prof. Mura and Prof. Nachi, who've worked around the world, and they'll be more than happy to assist in preparing you for your specialization and destination of choice as part of your post-graduation ceremony. In the words of Carl Jung, medicine cures diseases, but only doctors cure patients. Thank you once again for joining us. Do follow us on Facebook, which is Triple MC Malaysia. I repeat, Triple MC Malaysia. We wish you a great week ahead, and we hope to see you again at our next webinar. Thank you so much.
Thank you.
Welcome. Bye-bye.
Bye-bye.